Yeah, absolutely.
Great. Welcome, everybody. Thanks so much for this month's Tech Doc webinar. I've got Josh Bub with me today. He is the founder of Pure Family Medicine. Please feel free to give comments in the comment section, questions. We're going to be talking about adopting and adapting new technologies in direct primary care and healthcare. And we're really going to be focusing about direct primary care, our practices. You know, one of the things, why is this important? Because I really think when I pitch to potential patients what direct primary care is about, I tell them this is kind of like a 1950s style small town doc that's high tech. And it's really important for our 24/7 access, the great patient experience. And so I think talking about how to start off with the end in mind. How do you start off your new DPC practice so that when you are fully up and running and you've got multiple practices and multiple docs, that you've got the right technology? Right. And how can we be thinking about adding on new technology? What are the ones to choose? How do you vet them, and how do you implement them? So we've got an expert at this. Josh Bub, he started Pure Family Medicine. I've seen lots of DPC practices over the years, and I like theirs so much I joined them. And so anyways, so first off, you have a bit of an unconventional story.
You can say that.
And you are not a physician, you're a veterinarian. Tell us, how in the world did you come to start up a direct primary care practice with your wife?
Yeah, well, you know, a lot of my clients used to say, gosh, I'm having such a great experience here. I wish my doctor was like this. And so my wife and I used to joke, and I said, well, why aren't you like this? And well, because I'm in corporate medicine, what can I do? And so it's always been the dream to give a great patient experience and provide that. But you know, rewind 6-7 years, and my wife, Dr. Rebecca Bub, and I were both practicing, right? I was practicing in veterinary clinics. She was practicing in corporate medicine. And life has a funny way of kind of forcing you into the path you're supposed to be on. And mine, unfortunately, happened to be that I actually suffered an illness that made me leave veterinary medicine. And a bunch of things combined, but the short of it is that I had just an awful experience in the medical system with just terrible customer service. You know, I had my wife advocating for me, but I thought, gosh, what if patients don't have a doctor advocating for them? What does that experience look like for them? And that kind of happened at around the same time that she was suffering burnout. You know, we have 3 children, and shortly after having our 3rd kid, she said, well, I'm going to go back to part-time. And well, you know, her patient panel just kept growing. And so all these things combined to basically lead us in a roundabout way into the direct primary care space, you know, with ultimately the goal of better experience for our patients and doing it in a way that was sustainable for our family, you know, which I think a lot of people can probably sympathize with. That's, I think, why a lot of DPC docs ended up where they are at, right? Both from a patient care standpoint and a personal, you know, kind of a quality of life standpoint.
Well, I know that you started up at a very unusual time, 2019. What was your experience?
That was great. That was great timing there.
Tell me about that. What was that like?
Yeah, very interesting. And, you know, when the practice started, we opened in August of 2019, and it was mainly my wife. I had a very informal role, kind of helped her cobble together some systems and got her on her way and going, and formally joined the practice at a later date when the practice could support it. But sometime, 6 months after we opened, a little thing called COVID came, and I distinctly remember a period of a month us just sitting at home, and you know, we have about 50 patients at that time, and thinking, oh my gosh, what are we doing? What did we get ourselves into? How is this going to work? And we just basically started providing patients with the information they wanted and needed. We did a lot of webinars. We, you know, kind of did just a lot of interactive marketing through Facebook. Basically, everybody was sitting at home worried about this, worthy experts, you know, in patients' eyes on COVID. And so we just started providing them the information that they needed. And in a way, that kind of started our practice exploding a little bit during COVID, which was completely unexpected. But very pertinent to today's topic, technology had a huge role to play in that, because we were at home. Our practice was closed. Without technology, that would have been the end of our business. And instead, it was the beginning. Fast forward again, gosh, how long ago was that now? 4 years? It's crazy.
Yeah.
And
Yeah.
we're at 4 doctors. So
Almost 5. So tell me, what philosophical measures or priorities did you and Becky have when you were starting to think through how you wanted to build your practice, and what types of technologies you wanted to add to your tech stack?
Yeah. Well, you always have to start with the goal in mind, right? So the goal for us was better patient care at a reasonable rate, in a way that was, again, sustainable for us and our family. So what does better patient care looks like? It looks like decreased barriers, which is partially what DPC is all about. Patients pay a monthly fee. They have access to their doctor. They don't need to worry about if something is severe enough to warrant a visit, right? And so how can we enhance that experience? And Spruce, major part of our practice. I'm sure most people listening are utilizing Spruce, and if not, have at least looked at it. What a great way to reduce barriers between the patient and the doctor, and just allow them to get in contact with them. And specifically, we utilized a lot of their custom workflows to build in a on-call system, so that patients could get in touch with their doctor when they needed it, without it interfering with the doctor's lives. The doctors did not get text messages and phone calls to their personal number. They just got a page from the Spruce system. So that's probably the best example of how we set up our systems to achieve our goals. Hint, obviously a massive part of our system. What's the largest expense that a traditional medical office has that DPC doesn't? It's administrative overhead, and Hint allows you to reduce a ton of that. And so Hint is integral into our practice, and not only from a just billing standpoint, staying on top of those memberships, but we've built it into our sign-up process so that we create a seamless sign-up experience for patients, right? You want to reduce barriers at every step of the way. And we get sign-ups in the middle of the night on weekends when our staff is not even there. And that's thanks to a good website and Hint allowing that. So, always got to start with the goal in mind, and then there's going to be technology that helps you get there.
Yeah. Well, and you mentioned Spruce. Some of our listeners may not know what Spruce is. It is a communication with patients, so they can secure texting platform. After hours, they can message you, they can page you, so that make sure that we can have 24/7 access, which has been really helpful. And it integrates nicely with EMRs and with Hint. Now, you have built it in a way so that there are a lot of different ways that patients can communicate. How are the different ways that you have set it up that patients can communicate?
Yeah. Patients can get in touch with us directly through the app, which they install on their phone, or they can access through just a web browser. They can text our practice. They can call our practice. They can email our practice. All of it gets funneled into Spruce. And so for our staff, it's just the one place they need to look for patient communications, and it's actually so integral to our practice that we disable the patient portal, just because when we started our practice, patients would message us through the patient portal and would get a slower response than Spruce. And so we just deactivated it, right? And we just use Spruce for that. But again, it's, how did we get there and develop all these channels for patients to communicate with us? Well, we just looked at what the patients wanted, and we found that most patients loved using Spruce. It was really convenient. We have a backup plan just in case there's, a patient who's not tech savvy or has not set up Spruce yet. How do they get in touch with us? Well, the natural thing that most people would do is call the practice. And so on the weekend, if they call, it funnels them into an emergency paging system. And so there's always a way using that tech stack for patients to get in touch with us, even if they're not trained on the use of the technology. And ultimately, that's one thing that we'll get into later in this talk is tech is great, but you've got to make it work for yourself, and you've got to make it work for the patients. It can't be an obstacle.
Yeah. And you mentioned there's a bunch of different ways people can interact. They can text, they can call, they can schedule online. How often do people actually pick up the phone and call? Or is the phone going off the ringer? What's that experience like?
Our phone rings a lot less than you would expect it to, although it seems that when it does, it's 10 patients calling at once, right? But that's the great thing. And that's a great example of how we built our practice in a certain way when it first opened. And it's really been beneficial now that we're larger. Think about a solo doctor at the practice. They're not going to have time to answer phone calls. And so we knew that we wanted to start lean. We had to start lean. And so it was just my wife, no medical assistants, no me, nothing, just her at the practice. And so that's why Spruce is so integral as a piece of technology, because now we don't need to have a reception staff answering the phone. If a patient calls while a doctor's in the room, we get a message on Spruce. The doctor gets out of the room. They see that that patient is called. The patient will get a voicemail. Hey, if you're getting this voicemail during business hours or with another patient, we'll get back to you as soon as possible. Or use the Spruce app and get directly in touch with us. So fast forward to today when we have 4 doctors and our phone still doesn't ring that much because almost all of our patients are on Spruce, and they prefer that. You think about yourself as a patient. If you have a question during the middle of the workday, you do not want to pick up the phone in the middle of your workplace and talk to your doctor about something personal, or even have to get on the phone with the reception staff and then get transferred over to maybe a nurse and then maybe get to the doctor, or maybe play phone tag. Send a message. It's off your plate. It's in front of the doctor. They'll get back to you. So, just a great example of how technology's helped our practice. And what does it look like in practice? It's our phones don't ring very often.
Hey, we got a question here. Ted said, what key demographic features would you look for in a community when deciding whether to open up a DPC practice?
Yeah, great question. And it's a bit of a nuanced answer, and it depends on, do you have flexibility in your location? Are you looking to open up a practice in your hometown and just looking at the right location, or do you have geographic flexibility to go wherever you want? And a lot of this discussion today, it's going to be very different if you're in a metro area versus if you're in a small town. The networking and the connections that you make in a small town will be so much more integral to building your practice than in a major metro area where you can rely on traditional marketing as well. But that question also is, what is your price point? What does your service level look like? How many patients per doctor are you planning to have? And the simple answer is there a need for healthcare in your area? And I think the answer is yes. So I could make an argument that what demographic features would you look for? Are there people around you? Because DPC is such a great option for everybody that you can make it work everywhere, but it's going to influence what approach you take to opening the practice.
Well, and when you're starting a DPC practice, most of us, we started with 0 patients. And then the question is how can you build a practice in a timely fashion so that you can pay the bills and be able to pay yourself? And so maybe what we do is let's talk a little bit about tech that you've utilized in our community for marketing.
Yeah. That's a great segue, because when we opened, we're West Denver metro area, so we're in a major metro area, and we tried everything when we opened. And obviously, COVID had a large influence on what we ended up pursuing, because when we opened, we did a ton of in-person marketing, going to networking events, chambers of commerce. We were multiple times a week going out after work. I say we, my wife mainly was doing at that point, just to network and to get people to learn about our practice. That is a really, really slow way to build your practice unless you make the right connections immediately. Now, someone like Dave, who is an extrovert by nature, probably has more success at doing that than someone like my wife or I, who are introverts in nature. So that comes into play as well. But we found that was not really successful in building our practice. Where in a small town, that may be key to building your practice, right? There's so many more personal connections and being involved in your community that, while it's always important, it's critical in a small town. But COVID hit our practice, and we very quickly had to pivot to online marketing. And that happened to be the thing that worked. And that's what we ended up sticking with. And that was kind of out of necessity because in-person events were shut down. We still did our business networking via Zoom, but that was just not really effective or useful. And so online marketing, what platforms are available for that? You're really looking at Google, Facebook, other social media if you're really tech savvy and like seeing yourself on video, TikTok. But that's not our cup of tea. And so those platforms can be really intimidating to get into because it's hard. You either are tech savvy and you can teach yourself how to do online marketing, or if not, you may stumble through it. You may waste a lot of time, waste a lot of money. And like you said, Dave, it's all about how can we quickly get this marketing effort up and running, because everybody's up against a little bit of a clock when they open a DPC practice with no patients. And so my kind of general advice on platforms for technology is, we'll just take Google Ads, for example. Either learn it and learn to use it effectively, or hire somebody who can, because patients aren't going to come if they don't know about you.
I have been pleasantly shocked what high percentage of my patients have been through Google Ads. And then after that, it was word of mouth.
Our patients.
Yeah. And then our female docs, they get a lot of patients through the Facebook moms pages.
Yes.
And I don't benefit from that, except if sometimes I get, a family member.
You got to create a Facebook dads page, Dave.
Oh, hey, you got 4 docs in the practice. How many support staff?
How many support staff? Right now, 3 support staff. That is all thanks to technology, right? And that is a major way that we can offer the service we can at a price point that we can, one special thing about our practice is we allow our doctors to carry the number of patients that they want. And so, most of them have settled at more of a part-time panel, and we couldn't necessarily do that if we were over leveraged with staff. Honestly, I love our staff. They're amazing. They do a great job. 3 staff sometimes is not enough. 3 staff members sometimes is too many. There's ebbs and flows, but technology kind of helps smooth that out, because if we had double the amount of support staff, which is probably what we would need if we didn't lean so heavily on tech, there would be a lot more overhead. Our doctors would need to see a lot more patients, and the busy times would be more chaotic, and the slow times would just be more people sitting around wondering what to do with themselves.
Yeah. I think it's not a good thing to have your staff underworked or overworked, because there's problems with both. And I found with 3 staff and 4 relatively part-time docs, I think we're pretty evenly. I think we got a nice happy medium there.
Yeah.
This is a fascinating point. John mentioned a comment here, and please share your tech wins and stuff. John said, have you all considered integrating a Bitcoin strategy or practice? No, I would love to look more at this. By accepting Bitcoin and Lightning Network payments, you can lower transaction fees, strengthen your independence by saving Bitcoin on the balance sheet, and marketing to align consumers who care about taking responsibility. Love this idea. Have you thought about it, Josh?
No, it's because I was invested in Bitcoin and then it crashed and I was soured on it.
Well, I bought all my Bitcoin last year and I've been really happy with the
You're
rise.
welcome to everybody who is now invested, because as soon as I sold, it went back up, right? That's how it goes. No, we haven't considered that, and it's really interesting. I know some countries and states are really leaning heavily into Bitcoin and using that, and I know Colorado accepts Bitcoin, I think, for tax payments and things like that. So it definitely is fascinating. What I would say to that is it depends on your patient base, right? If your patients are asking for it, absolutely look at that. If your patients are not really interested in it, then it may not be something that you benefit a ton from, but who knows, maybe you're missing out on some patients that would otherwise be joining you if you accepted it. I think that's a really intriguing, and I think it's, if you're adopting that as a practice, you're going to be very much on the leading edge, and we'll see in 5 or 10 years if that becomes the norm or if it's more on the fringes still.
And John just said there's a big Bitcoin community in Denver that would be really interested in our practice.
Interesting.
And John, are you a DPC doc? Are you running a DPC practice? And if so, how is that working in your practice? Let me take this one from Ted. How often do you engage patients in telehealth? Really often. I probably do well more than 50% of my practice is in telehealth.
Yeah.
This has been an enduring tool after COVID. Yes, but not quite as much. So before COVID, I think I was probably 10% telehealth. And then when March of 2020 hit, I went and did 95%, 95% telehealth. And then now it's probably 60% in my practice. And that's probably somewhere in the right ballpark for a lot of people. Do patients want an in-person experience? Yes. My patients, they want both. They want to have unlimited text. They want unlimited in person. They want unlimited video and phone call. And so I think that having many different options, because a lot of times when people are in town, I've got a lot of people that are snowbirds. They are in town for 6 months out of the year, and 6 months out of the year, they're some other place. And so you need to have that virtual, but then having in person to develop that personal relationship, especially for people, the young, healthy, tech savvy 20 and 30-year-olds, most of them don't really want to see me. It's all virtual. But I find that some of my older patients, that is a very important piece for them. What do you think, Josh?
Yeah, it's all about meeting patients where they're at. Again, like the Bitcoin conversation, if your patients want to use Bitcoin, you better find a way to do it. If your patients want telehealth, which they do, you got to find a way to do that. And I think that the only reason that it's been held back in the general medical community is because in a traditional insurance-based practice, it's only been recently that you've been able to appropriately bill for telehealth. And so that's, I think, why it hasn't gained more popularity. But when you offer it as an option to patients, and for every single visit to say, hey, would you like to come in person, or would you like to do telehealth? And you see what they say. I mean, it very largely depends on the issue, on the person, on the doctor, but it's about 50-50, I would say. Telehealth is really convenient. I know I personally would want telehealth whenever possible. I hate getting in the car and driving to my doctor's office and waiting, and I've got things to do. And if I can just hop on from home and have a visit in 30 minutes, that's amazing.
Great. Hey, so you started your tech stack, kind of thinking through like where you wanted to be. What were the challenges and some of the missteps that you ran into? What were some of the pitfalls that you would help our newly up and coming DPC practices to avoid?
Well, like many of us, I'm very type A. And so there was probably a lot of over planning that went into developing the stack before launching it. And I would say, don't be afraid to launch something and run with it and adapt on the fly, because you can sit there planning for years and have that actually be a massive barrier to the inertia of getting you going. Not saying don't go into it with a plan. Obviously, you should have one, but don't be afraid to take the leap, right? And then you can always adjust if you need to. A major stumble, there are certain technology platforms that just didn't work for us, right? And I would say it's both a major stumble to not try them, but also to stick with them for too long, right? Don't be afraid to try a new piece of technology if there is a goal you are looking at accomplishing on our practice. So one thing that we were looking at is like, hey, how do we follow up on patient care reminders and things like that? And so for a long time, we just tried to cobble together pieces of software, on our own, maybe Google Sheets or, maybe just a manual sheet in the office, and then tried a bunch of different software platforms. And, I probably waited too long to try those platforms, but then when they didn't work, I kind of was pretty quick to jump out of them. And so I think that's probably the biggest blunder, was waiting too long to try something, but then also maybe sticking with something for too long if it's very clear it doesn't work. Like, don't be afraid, even if there's a setup fee or something like that. This is just the cost of doing business sometimes. And you may stumble on a piece of software that makes your practice sing, but you're never going to find that if you're not willing to take the leap and try to fail sometimes.
Well, no, and you're a pretty tech savvy guy. I mean, so your background is in veterinary medicine. Your degree is not in IT, but you've clearly done a lot in your history. First off, how hard was it for you to kind of learn and add these technologies on your own versus did you wish you got some help? And what would you recommend for folks that may not be very tech savvy? How would it be best for them to set up their tech stack?
Yeah. Well, I think you have to look at what your limiting factor is. Is it time or is it money? Because learning the tech is going to take time. Bringing somebody on, if you don't have the time to learn the tech, is going to take money. And so I think you have to have the tech. Again, certainly this is not advice that fits for everybody. If your goal is to have a very small practice, just really focus on quality of life, have a really small patient panel, and you can do that. You don't necessarily have to bring on all this tech, but it can absolutely help your practice. And so if you've made the decision to do it, you either need to take the time to learn it, and you do need to have some sort of propensity for learning tech because it can get fairly complex, or you should bring on somebody who can help.
Do you find, so you selected Hint, Elation, and Spruce as your main 3 core components. Do you feel like you need to have a IT degree to be able to do those, or can a DPC doc that's coming out of residency figure it out on their own?
Yeah.
Or whatever tech stack they select.
Yeah, you absolutely can figure it out. The reason that I picked those 3 is because they were quite simple to use, but you could go in depth in them, and build the advanced features. They had really, what I love about them is the integrations. My staff does complain about the number of programs and platforms that we have in our practice. And admittedly, it is a lot, but we've focused on creating a great patient experience at the expense of maybe making it a little bit more difficult to train our staff, which we'll put a pin in that because I know we want to get back to that. But the great thing about these 3 systems is they were very easy to learn, very easy to implement, but had the powerful tools in the background where you could really build some powerful integrations between them and bring on other pieces of software to fulfill the needs of the practice, versus picking just some of the EMRs that we looked at. You were stuck in that system, and if they had the capabilities in it, great, and if they didn't play well with anything else. And so I guess when we built our practice, I knew the patient experience I wanted to create and help, and my wife knew the patient experience she wanted to create. And we found the tech to build that. We didn't just sign up for a piece of tech and then figure out what can we do with this, right? So we started with the goal and found the tools to help us achieve that goal.
Do you find there's different tech capabilities required for a 1-doc practice in a single location, and then moving up to 4 and maybe even more docs in multiple locations? And if so, what are the additional requirements needed as you grow?
I think the answer to that should be yes, but in our practice, it's a no. And we started knowing that we wanted a couple of docs in our practice. And honestly, that was just for our quality of life. My wife did not want to be on 24/7, wanted to be able to take vacations without having her patient care suffer. And so we built the practice from the ground up, knowing that we would have multiple doctors, because we just set out to say, if this stops at 1 doctor, we have not achieved what we were going for, because that's not the quality of life we wanted. So we built our practice to be able to scale to that point, used tools that we knew we could add another doctor onto quickly, and just build into our system. But if that's not your goal, then you might select a different tech stack, or you might not build it out from the beginning needing that. So there's not a clear answer to that question. I think you certainly could build the tech stack that you need to just blow up and redesign as you grow, but it's very possible to build it from the get-go to be able to scale.
Okay. Let's see here. Not sure if we can answer this or not. Since we're talking about platforms, what do you currently use? So we're on Elation as our EMR. And Hint for billing and our practice management, and then we use Spruce for our patient communication. So what EMR system integrates best with? Hint integrates with them all. I don't know an answer. Is there an answer which one best integrate? I mean, if you want to have one that's built in together, you do Hint Connect, or excuse me, Hint Clinical, because it's all in one. It's all the same system.
And I guess I would answer what does best mean? Because best could mean something different for everybody. I think Elation integrates well. It pulls the patients over really nicely. It brings tags over really nicely. I probably can't comment to the other ones because I have not used them. But I know that there are multiple ones that do integrate, which is why Hint is such a great platform for our practice, because we look around at multiple EMRs. We're constantly reevaluating, and Hint is not a barrier to us switching an EMR if we ever wanted to do that. We're pretty happy with Elation right now. It's not perfect, but it's great for our practice.
Okay. And when you're hiring staff, since we're such a tech-heavy practice, what are the characteristics? What are you looking for in staff when you're hiring them?
Yeah, I mean, they have to be comfortable with tech. To put it really basically, if somebody is not comfortable with using technology, they are not going to be very happy in our practice because we lean so heavily on it. And we've designed our systems so that they're easy for patients to use. But on the back end, unfortunately, we've got about 5 or 6 different core systems that we use, and our staff has to be trained in it all. And so when I'm hiring, generally it's pretty clear from the get-go if somebody at least has a basic understanding of tech, looking at their resume, when we connect on a Zoom meeting, are they able to operate Zoom and do what? It's pretty clear if somebody is decent at tech or if they just are hopeless with it. And I straight out ask, what's your comfort level with technology? And I just am very upfront in saying, we use all of these different platforms. You're going to be on the computer a lot using the software. Is that something you are comfortable with? And you can get a pretty honest answer pretty quickly. But tech is such an integral part of everybody's lives that I think as you're interviewing somebody and getting to know them, you can get a good feel as to whether they're going to, pick it up quickly or not. The two things that we hire for in our practice are customer service and ability to use tech. And then a third would be comfortable, basically with medical procedures and terminology and things, because we could teach that and we do teach that. Fortunately, we've been able to find employees who are great at all three, and have been really fortunate in that regard.
So what's your experience like then? I may know the answer to this already, but what's your experience training your staff and also getting the patients up and running on the technology that the practice uses?
Yeah. I mean, the training is just, being with them there day to day, using the systems alongside of them, giving them probably a little bit of an extended training period before they're comfortable and kind of giving them access to maybe 1 or 2 platforms at a time until they feel really comfortable with that one and then moving on to the next, and whenever possible, we try to make that process easier and more standardized for them. But we're such a small practice that we don't need yet at least a formal training program. We're not a massive multi-office location where we need to have this procedure, well-oiled machine in place for training staff. It's very personal. We hire somebody, we're there with them every day, we work with them, and just take it slow. And fortunately, all the systems we've picked, even though there's a lot of them, they are relatively easy to use.
Got it. And then staff and then patients, how was the patient adoption experience?
That is where you need to make sure it is as simple as possible to use, because how many apps are you asked to download on your phone every day? My phone is overloaded with apps. And so sometimes I worry about asking patients to download another app for their doctor's office. But we just have one. We just use Spruce. And so you've got to make it as simple as possible. Every step that a patient needs to go through, whether that's signing up for your practice, whether it's, even through the marketing funnel, getting to your website, once they're in their practice, how many steps does it take them to fill out patient paperwork or to set up your messaging? Every step that somebody has to take, you lose a proportion of your patients. And so you want as few steps as possible in a way that just works for everybody. So for our practice, when a patient joins through Hint, they get a tag that says Hint status active that gets pushed to Spruce. And Spruce has a workflow in place that when they see that Hint status active tag, they send a text message to the patient saying, welcome to Pure Family Medicine. Click here to join Spruce, our secure communication app. Patient clicks that, sets up an email and password, they're in. And so then I'd say that captures probably 75 to 80% of the patients. And then it's just a matter of staff reinforcing with patients, if they call or they text or they email, hey, have you set up Spruce? Like you're going to love Spruce. It's so much easier for you to use. And so you really just want to make it simple. You really want to make it simple.
Got it. Now here's a question. Does Elation EMR integrate telehealth? Yes. So we're going to set up a telehealth appointment. And it's not a separate platform. And how do you document a telehealth encounter? I just have a virtual visit and I document while I'm chatting with the patient. So it's really simple. Let's see here. Future. What's your future plans, Josh? What's in your mastermind? Where do you want to go and what are you hoping to implement?
Yeah. I mean,
and this is a wish list. It may not be even available, but where would you like to be in 10 years?
Yeah, absolutely. I mean, our practice, our goal has always been to have 4 doctors, 5 doctors, and to just, have just a good functioning practice. All of our employees and doctors are happy, our patients are happy, and we're almost there. So I'd like to think that in 5 to 10 years, we're still going to be at that place. For technology, that's an interesting question. And I think that the buzzword lately is AI, right? Everybody's talking about AI. In healthcare, AI is being used to make doctors more efficient. And I don't think that's what DPC doctors want or need. Yeah, it's not about efficiency. It's about patient experience, patient care. And I'll ask this question to you. Do you really need an AI to help you write more concise notes or to save you note time?
What I want is I don't want to touch the laptop.
Right.
So I want to have a patient interaction and have the computer have a very small role. And I don't like having to be typing while I'm talking to the patient. So, as AI becomes more and more robust, to have it compose the notes in a SOAP format, to be able to compose the order. So at the very end, I can be able to say, make it so. That's what I really want. We'll get there. I know that there's lots of AI options for composing notes. The other thing is clinical decision, like real-time clinical decision support. So as I'm taking care of a patient that has diabetes, and if I'm about to send off a prescription, and then AI gives me some recommendations for some, potential other thoughts, that would be welcomed. I'd like that. And I think it would be really helpful. And I think we could deliver better patient care.
Yeah, absolutely.
So, all right. Hey, I know we're at time. I want to just say for those that are in the direct primary care community, Hint does have the DPC ecosystem. It's at our dpc.com, at hint.com ecosystem. We've got partners, we've got EMRs, we've got vendors, we've got help with finding folks to do sleep studies, cognitive testing. There's all kinds of different resources and vendors that you might want to check out. Also, we've got the Hint Summit coming up September 27th and 28th to our hometown, Denver. We'd love to host you. Come if you're a DPC practice, advisor, broker, employer that's interested in adding DPC to a benefit plan. If you're one of our channel partners or even a resident, we'd love to have you. We are excited to help med students and residents hear more about direct primary care. We even have scholarships. You can email summit@hint.com if you are a resident interested in direct primary care and would like to come. We would love to have you, and we will do our best to convince you to come join our movement. Thank you so much. Really enjoyed the time today. Thank you, Josh, for joining us.
Thank you.